All right, joining us now in studio is Dallas County Health and Human Services Director Zach Thompson. Zach, thanks for being with us.
Oh, thank you.
I know you're one of the point people on this. The CDC is in town now. They've made contact with your office, I assume?
Right. Early on, we were notified that an epi team would be coming to Dallas County.
And they've hit the ground?
They've hit the ground, and we'll be meeting with them tomorrow. We will also give updates to our emergency managers as well as our public health advisory committee as well on tomorrow.
Okay, so you'll meet with them tomorrow. What are they doing tonight? Are they doing anything tonight, and what do they get after tomorrow?
Well, one of the things you have to do is hit the ground running, boots on the ground, to look at the contacts. We have to look at tracing where this patient went to. Who did this patient come in contact with? That's critical in contact investigation, and that's where we are right now. So let's paint the picture. One, the family. We do an interview with the family. Then we have to do a follow-up interview with the DFR staff, as well as the hospital employees. So this contact investigation, we're looking at a small number of people that we'll be making contact with. For the Dallas County residents, I want to be very clear, 2.4 million people in Dallas County, but we're only talking about 12 to 18 people or less right now.
They are nervous, though. You know as well as I do, not just Dallas County. You're responsible for Dallas County. People in Arlington probably thinking, okay, what should we do? You know, what should I do? What should they do?
Well, right now, allow CDC, Dallas County, Presbyterian, and the State Health Department to really do the contact investigation, to give updates, because right now we think that it is a very small number, as I stated before, of people that we need to follow up on. But there should not be a fear if you've not exchanged bodily fluid with this patient. Right. And so that's the element. We will do follow-up with our DISD and other ISDs to give them an update as well of what they should look for. But right now, we only have a small window of people that we're looking at, and we're clearly focused on that. But I want to reassure Dallas County residents the commitment, the fact that you have CDC on the ground, their EPAs are trained in contact investigation. Contact investigation is what we do every day. Foodborne illness, right. West Nile virus, that's what the health department is doing. And so we clearly are focused on identifying those individuals who were in contact with the patient and providing follow-up contact.
Let me represent the skeptical, I guess, at this point. A lot of people say, yeah, body fluid, but if somebody sneezes, they talk about sweat, they talk about all kinds of concerns, but they're just generally concerned, and they don't like when they're told basically your chances are minuscule, don't worry about it. And then they see video of an ambulance that took the guy to the hospital, disinfected totally, and sitting vacant in a parking lot not being used because it's worrisome. That's a sign that there are problems. And so that makes people nervous and wonder, you know, are we getting all the information? So tell me.
Based on what we're seeing in Africa now, and the devastation that Ebola has in that country, there should be a fear. But it should be a healthy fear that's directed based on science and allowing our epidemiological staff as well as the CDC to be focused on those impacted individuals, not the broader community. I keep pointing out 2.4 million, 12 to 18 people. That's what we're clearly focused on right now. This is not a widespread epidemic. First of all, this is not Africa. This is not a third world country that doesn't have an infrastructure as it relates to public health system. You have the best public health system, hospitals, clinicians, infection disease doctors in the world right here in Dallas County.
All right. Were you comfortable with how you found out about this, the communication, what happened after you found out and what things started happening?
Well, I'm comfortable. Based on the information that we received, we're hearing that the patient presented themselves to the hospital. So we're basically comfortable with the process, and it's going through the process right now. It's going to take time, but I'm sure there's a teachable moment in this as well.
Yeah, and you talk about that. Clearly, we had Dr. Paul Pepe on earlier this afternoon. He talks about teaching all hospital staff about the protocols. The mayor talked about the training and the protocols, and that is so if somebody presents, they're supposed to be asked certain questions, and so a person with Ebola doesn't get released back into the community while they have an active case and infect others. But that's what happened. I don't want to toss anybody under the bus, but that is what happened. And so something went wrong, or it didn't go the way it should. You tell me.
Well, I don't know. We wasn't there that night that he came in.
Well, we know the result.
We know the results, but I trust what Presbyterian in terms of their follow-up and what they did. I stand with them. I stand with the medical community in terms of their response. I think we can, you know, I don't want to be Monday morning quarterback. I get enough of that myself. And so my take on it is right now we know what we're up against and we're clearly focused, but Presbyterian did a great job. And now that we got CDC and the state health department involved in this, we'll be able to stop this issue immediately.
Let me ask you something. You're responsible. I don't know if you feel responsible. Do you feel responsible for Dallas County the people's health in Dallas County?
Without a doubt.
Okay, let me ask you a question. So this person was able to get on a plane, was not showing signs, flew to DFW, and had full-blown Ebola. You okay with flights in and out of countries with a lot of infection? Do you have any qualms about that now, as a person who represents people in the community? You're not a federal mover and shaker, but are you okay with flights going out of countries?
Well, what I'm not satisfied with is on the side where they're entering the plane. I don't know what's going on there. Let's be very frank. I don't know what is happening in terms of the assessment done. I'm not questioning what they do in Africa, but it's not America. And so we have to do a better job in assessing if we're talking 2 to 21 days before someone shows a symptom, we really have to evaluate before we allow people to come into this country. And again, I'm not speaking for Dallas County. I'm just speaking on the fact of what my observation is that, and I'll be very frank, there is no reason for anyone to have made the trek here to the United States in the situation we are now. But again, that's my opinion, and so we'll vet that out.
And that'll be discussed, I imagine, right? You'll have an opportunity to voice that concern to other people who can.
Well, I think most Americans will be concerned. I don't know what's going on. A thermometer in your mouth at the first time you show up at an airport in Africa, I don't know if that's good enough.
Okay. Zach Thompson, we're going to have you stick around, all right?
Okay.
We're going to be back to you, ask you some more questions. We're going to thank you for being here, and we'll talk to you just a little while later, touch back and get an update with you. Thanks a lot.
All right. Thank you.
For the insight.